Do you know that a mini-stroke, TIA, transient ischemic attack, is very common in the elderly? If not properly recognized, its symptoms can be mistaken for other conditions, leading to misdiagnosis. According to the American Stroke Association, approximately 240,000 people in the United States experience a mini-stroke each year. Even more concerning, nearly 20% of those suspected of having a TIA will suffer a full-blown stroke within 90 days. A mini-stroke occurs due to a temporary blockage of blood flow to the brain, often caused by a blood clot. Fortunately, in most cases, the clot dissolves or moves away on its own, causing symptoms that last only a few minutes. However, this does not mean that a mini-stroke is harmless. In fact, it is considered a warning sign of a future major stroke. Therefore, recognizing the early signs of a mini-stroke is crucial to protecting your health and that of your loved ones. Watch for these symptoms to take timely action. Dizziness or loss of balance. When blood flow to the brain is reduced, a person may experience dizziness or loss of balance, one of the most common signs of a mini-stroke, TIA. This symptom often appears suddenly, without an obvious cause, and may be accompanied by lightheadedness, faintness, or disorientation. People experiencing a TIA may find it difficult to stand up from a seated or lying position, stumble easily, or even fall while walking on a flat surface. In some cases, they may feel like their surroundings are moving, similar to motion sickness, even when they are standing still. This occurs due to the temporary blockage of blood vessels, depriving the brain of oxygen and nutrients needed for balance control. In addition to dizziness, coordination problems can also occur. Affected individuals may feel weakness in their limbs, slower reflexes, or difficulty controlling their movements as usual. Simple actions such as lifting a foot, grasping objects, or walking may become more challenging. This condition may last only a few minutes, but if not detected and addressed promptly, it could signal an impending major stroke. If dizziness or loss of balance is accompanied by other symptoms such as numbness in the limbs, facial drooping, slurred speech, or blurred vision, seek immediate medical attention. To reduce the risk of TIA, maintaining a healthy lifestyle is essential, including blood pressure control, regular exercise, and a balanced diet. If you or a loved one frequently experiences unexplained dizziness or balance problems, consult a doctor for proper evaluation and medical advice. Numbness or mild paralysis on one side of the body. Numbness, weakness, or mild paralysis on one side of the body is a clear sign of a mini-stroke, TIA, transient ischemic attack. This symptom often appears suddenly, affecting the face, arm, or leg, and typically occurs on one side of the body due to the temporary interruption of blood flow to the brain. The affected individual may feel loss of sensation, tingling, or heaviness in the hand, leg, or one side of the face, making it difficult to control movement. In some cases, they may struggle with gripping objects, moving, or performing simple tasks such as lifting their hand, holding a spoon, or buttoning a shirt. If facial muscles are involved, the person may experience facial drooping, difficulty smiling symmetrically, or drooling due to impaired muscle control. Because a TIA occurs quickly and symptoms resolve on their own within a short time, many people tend to overlook these signs without seeking medical attention. However, this can be a serious warning of an impending major stroke. Without early detection and treatment, the risk of a full-blown stroke increases significantly, leading to permanent brain damage or other severe complications. Beyond numbness and weakness, balance and coordination difficulties can also arise, increasing the risk of falls, particularly in older adults. If you or a loved one experience numbness or mild paralysis on one side of the body, seek medical help immediately to minimize the risk of serious complications. To prevent TIAs, it is crucial to control risk factors such as high blood pressure, diabetes, high cholesterol, and a sedentary lifestyle. Engaging in regular physical activity, maintaining a healthy diet, and scheduling routine medical checkups can help reduce the risk of stroke and promote long-term brain health. Speech difficulty or visual disturbances in the elderly. A mini stroke, TIA, can affect brain areas responsible for speech and vision, leading to speech difficulties or visual disturbances. These are serious warning signs that should be recognized early to prevent a major stroke. Affected individuals may experience difficulty expressing their thoughts, slurred speech, unclear pronunciation, or using incorrect words. In some cases, they may struggle to understand what others are saying or be unable to respond properly. This symptom often occurs suddenly, leaving the person confused and unable to control their speech. Apart from speech difficulties, some people may also experience vision problems, such as blurred vision, double vision, or temporary blindness in one eye. This occurs when blood flow to the brain's visual processing areas is temporarily interrupted. The affected individual may feel as if a dark shadow is blocking their vision or find it difficult to recognize faces and objects around them. These symptoms typically last for a few minutes to several hours and may disappear on their own. However, they should never be ignored, as they can be an early warning sign of a dangerous stroke. Without timely medical intervention, this condition may lead to permanent brain damage, impairing communication abilities and significantly reducing quality of life. If you or someone you know experiences these symptoms, seek medical help immediately. Preventive measures such as controlling blood pressure, maintaining a healthy diet, exercising regularly, and avoiding risk factors like smoking and excessive alcohol consumption can help reduce the risk of TIAs and major strokes in the future. Reduced concentration. A mini stroke, TIA, Transient Ischemic Attack, can reduce blood flow and oxygen supply to the brain, affecting concentration and making individuals feel disoriented or unable to maintain focus. This symptom can appear suddenly, interfering with work, daily activities, and overall quality of life. People experiencing a TIA may find themselves easily distracted, struggling to focus on a specific task, or taking longer to process information. In some cases, they may forget recent events, confuse details, or have difficulty following conversations. This can lead to feelings of frustration, anxiety, or even a loss of confidence in social interactions. Although concentration issues are usually temporary, they may recur in individuals at high risk of stroke. If left undiagnosed and untreated, this symptom could be an early warning sign of more severe cognitive issues, such as cognitive decline or dementia in the future. In addition to affecting attention span, a TIA can also weaken other cognitive functions, including memory, information processing, and decision-making. Patients may struggle with planning, organizing tasks, or performing routine activities. This not only creates inconvenience in daily life but can also increase the risk of accidents, especially in older adults. To reduce the risk of concentration problems caused by TIA, it is crucial to control risk factors such as high blood pressure, diabetes, and high cholesterol, maintaining a healthy diet, engaging in regular physical activity, and stimulating the brain through activities like reading, solving puzzles, or learning new skills can help improve cognitive function and protect brain health in the long run. If you or a loved one experiences unexplained concentration difficulties, consult a doctor for evaluation and guidance. Confusion and disorientation. A mini stroke, TIA, can affect the brain regions responsible for memory and cognition, leading to confusion and disorientation. Patients may suddenly feel lost, unable to recognize themselves, unaware of their location, or uncertain about the time. This is a serious warning sign, as it not only impacts cognitive function but can also increase the risk of falls or accidents, especially if the individual is driving or performing tasks requiring full awareness. People experiencing a TIA may feel bewildered, disoriented, and unable to make rational decisions. They might forget recent events, mix up day and night, or fail to recognize familiar people. In some cases, individuals may become irritable, anxious, or panicked due to their impaired perception. They may repeat the same questions or react negatively when struggling to understand their surroundings. Although this symptom is typically short-lived and may resolve on its own, It should never be ignored. It could be a warning sign of an impending major stroke, which could cause severe brain damage, permanent memory loss, and long-term cognitive impairment. Confusion and disorientation can often occur alongside other TIA symptoms, such as reduced concentration, speech difficulties, or weakness on one side of the body. If these signs appear, immediate medical attention is crucial for accurate diagnosis and timely treatment. To prevent this condition, maintaining a healthy lifestyle is essential. Controlling blood pressure, blood sugar, and cholesterol levels, combined with a nutrient-rich diet and regular exercise, can help reduce the risk of TIA and protect cognitive function. Additionally, engaging in brain-stimulating activities like reading, solving crossword puzzles, or learning new skills is an effective way to preserve mental sharpness and lower the risk of cognitive decline in the long term. Severe headache. A sudden and intense headache can be one of the early warning signs of a transient ischemic attack, TIA. Unlike a typical headache, a TIA-related headache often occurs unexpectedly, without an apparent cause, and is usually accompanied by other neurological symptoms. This is a serious symptom that requires close monitoring, as it may indicate an increased risk of a major stroke in the future. TIA-related headaches tend to appear suddenly and are more severe than tension headaches or migraines. Patients may experience sharp, throbbing pain or a sensation of tightness around the head. In some cases, the pain may be localized on one side of the head or at the back of the neck. If the headache is accompanied by dizziness, loss of balance, vision problems, or numbness on one side of the body, it requires immediate attention. Unlike migraines, TIA-induced headaches do not typically present with warning signs such as flashing lights, visual disturbances, or tingling sensations in the limbs. The headache may last from a few minutes to several hours but often resolves on its own without immediate severe consequences. However, this does not mean that a TIA-related headache should be ignored, as it may indicate a temporary disruption in blood flow to the brain. If left untreated, the risk of an actual stroke could significantly increase in the near future. If you or a loved one experiences a sudden, severe headache with no apparent cause, especially if accompanied by other neurological symptoms, seek immediate medical assistance. Early diagnosis and timely intervention can help prevent serious brain damage. To reduce the risk of TIA and stroke, it is essential to maintain stable blood pressure, control cholesterol levels, manage stress, and adopt a healthy lifestyle. A balanced diet, regular physical activity, and avoiding harmful habits such as smoking and excessive alcohol consumption are key measures to protect brain health and lower the risk of future strokes. Fainting, syncope, or fainting, is a temporary loss of consciousness caused by a brief disruption in blood flow to the brain. It can be a potential warning sign of a transient ischemic attack, TIA, indicating reduced cerebral blood flow and an increased risk of a more severe stroke in the future. Although loss of consciousness usually lasts only a few seconds to a few minutes, it can lead to dangerous consequences, especially if the person is driving, walking on the street, or performing tasks that require full alertness. A TIA-related fainting episode often occurs suddenly, without clear warning signs. Before fainting, individuals may experience dizziness, nausea, sweating, weakness, or loss of balance. When unconscious, they may collapse, lose control of their body, and be at risk of injury if not assisted promptly. After regaining consciousness, they may feel confused, fatigued, or experience a mild headache. Not all cases of fainting are linked to TIA, but if it is accompanied by other symptoms such as numbness on one side of the body, vision disturbances, difficulty speaking, or a severe headache, it should be taken very seriously and requires immediate medical evaluation. In many cases, fainting may be caused by low blood pressure, irregular heart rhythms, or dehydration, but in older adults or individuals with a history of cardiovascular disease, the possibility of TIA should not be overlooked. If you or someone you know experiences unexplained fainting, especially if it occurs repeatedly, seek medical evaluation as soon as possible. Tests such as blood pressure monitoring, blood tests, Electrocardiograms, ECG, and brain imaging scans can help determine the underlying cause of syncope. To prevent fainting episodes and reduce the risk of TIA, it is crucial to control risk factors such as high blood pressure, diabetes, and heart rhythm disorders. Leading a healthy lifestyle, including a balanced diet, regular exercise, and stress management, can help maintain stable blood flow to the brain and reduce the likelihood of TIA and stroke in the future. Hallucinations, a potential sign of a mini-stroke, TIA. Hallucinations are a less common but possible symptom of a transient ischemic attack, TIA. When blood flow to the brain is temporarily disrupted, areas responsible for cognition, vision, and hearing may be affected, leading to hallucinations. This condition can be confusing and distressing for the patient and may increase the risk of vascular dementia if not detected and treated in time. Hallucinations caused by TIA can manifest in various forms. Some patients may see things that are not real, such as shadowy figures, flashing lights, or moving objects. Others may hear non-existent sounds, including voices, music, or knocking noises. In rare cases, individuals may also experience olfactory hallucinations, smelling strange odors, or tactile hallucinations, feeling as if someone is touching them when no one is present. These hallucinations may last only a few seconds or minutes before disappearing, leading many people to overlook them as insignificant and fail to recognize that they may be experiencing a serious neurological issue. However, if hallucinations recur frequently or are accompanied by other TIA symptoms such as loss of balance, numbness on one side of the body, speech difficulties, or severe headaches, they may be an early warning sign of a major stroke in the future. TIA-related hallucinations are often linked to damage in specific brain regions, such as the occipital lobe, responsible for vision, or the temporal lobe, associated with hearing and memory. When these areas do not receive sufficient oxygen and nutrients, neural activity becomes disrupted, leading to distorted perceptions of reality. If left unmanaged, this condition may progress to cognitive decline and increase the risk of vascular dementia. If you or a loved one experiences hallucinations without an apparent cause, seek medical advice immediately. Early diagnosis through brain imaging tests such as MRI or CT scans can help detect circulatory abnormalities in the brain and prevent serious complications. To reduce the risk of TIA and cognitive decline, it is essential to maintain stable blood pressure, regulate blood sugar levels, follow a healthy diet, and engage in regular physical activity. Adopting a scientific lifestyle not only protects brain health but also improves overall quality of life in the long run. Risk factors for transient ischemic attack, TIA, in the elderly. A transient ischemic attack, TIA, is a crucial warning sign of a major stroke, and it can be triggered by various risk factors. Recognizing and managing these factors is essential to reduce the risk of recurrence and protect long-term brain health. Below are the most common risk factors leading to TIA. 1. High blood pressure, hypertension. High blood pressure is one of the primary causes of a mini-stroke. When blood pressure is elevated, the blood vessel walls endure excessive pressure, increasing the risk of damage and narrowing of arteries, which can disrupt blood flow to the brain. If not properly controlled, hypertension can also promote blood clot formation, leading to arterial blockages. 2. High cholesterol, dyslipidemia. High cholesterol levels, particularly LDL, bad cholesterol, can accumulate in the artery walls, forming atherosclerotic plaques. These plaques narrow the arteries, reducing blood flow to the brain and increasing the risk of blood clot formation, which may trigger a TIA. Managing cholesterol through a healthy diet, regular exercise, and prescribed medications is crucial in lowering this risk. 3. Obesity. Being overweight or obese not only increases the risk of cardiovascular diseases but also contributes to mini-strokes. Obesity is directly linked to hypertension, diabetes, and high cholesterol, all major risk factors for TIA. Maintaining a healthy weight through a balanced diet and physical activity can significantly reduce this risk. 4. Smoking. Smoking damages blood vessels, accelerates plaque buildup in the arteries, and reduces oxygen levels in the blood. Nicotine also constricts blood vessels, increasing blood pressure and the risk of blood clot formation. Quitting smoking not only lowers the risk of TIA and stroke but also improves overall health. 5. Diabetes. Diabetes can damage blood vessels and increase the likelihood of blood clots. Additionally, high blood sugar levels impair the body's ability to repair blood vessels, making the risk of TIA higher. Proper blood sugar management through diet, exercise, and medication is essential in reducing stroke risk. 6. Sedentary lifestyle. A lack of physical activity raises the risk of obesity, diabetes, hypertension, and high cholesterol, all contributing factors to mini-strokes. Engaging in regular exercise not only improves blood circulation but also helps reduce stress, maintain a healthy weight, and strengthen the cardiovascular system. Even 30 minutes of daily activity such as walking, jogging, or yoga can significantly lower the risk of both TIA and major strokes. How to prevent a mini-stroke, TIA. A transient ischemic attack, TIA, is a critical warning sign of a major stroke in the future. However, you can minimize this risk by adopting proper preventive measures. Below are effective ways to protect brain health and prevent mini-strokes. Control blood pressure and cholesterol. High blood pressure and high cholesterol are two leading risk factors for TIA. When blood pressure is too high, the strain on artery walls increases, leading to atherosclerosis and blood clots. Similarly, high LDL cholesterol, bad cholesterol, can block arteries, restricting blood flow to the brain. How to manage it? Limit salt intake and avoid high cholesterol foods. Eat more vegetables, fruits, whole grains, and fiber-rich foods. Exercise regularly to maintain stable blood pressure. Take prescribed medications if you have a history of hypertension or high cholesterol. Avoid smoking. Smoking damages blood vessels, accelerates plaque buildup, and increases blood clot formation, raising the risk of mini-strokes. Additionally, nicotine constricts blood vessels and elevates blood pressure. Prevention tips. Quit smoking as soon as possible. Avoid second-hand smoke exposure, as it also raises stroke risk. Use nicotine replacement therapy or seek counseling if needed. Exercise regularly. A sedentary lifestyle contributes to obesity, high blood pressure, and diabetes, all major TIA risk factors. Physical activity improves circulation, reduces stress, stabilizes blood pressure, and promotes a healthy weight. How to stay active? Engage in at least 30 minutes of exercise daily, walking, swimming, yoga, etc. Combine cardio and strength training for better heart health. If you have a desk job, take a break every 30 to 60 minutes to move around. Take aspirin only as directed by a doctor. Aspirin can help prevent mini-strokes by thinning the blood, reducing the risk of clots. However, improper use may cause stomach ulcers or internal bleeding. Important notes. Do not take aspirin without medical advice. If you have a history of bleeding disorders or stomach issues, consult a doctor first. Aspirin is not a treatment for an ongoing stroke. Call emergency services immediately if stroke symptoms appear. Maintain a balanced diet. A healthy diet plays a vital role in preventing TIA by controlling blood pressure, blood sugar, and weight, while also reducing artery blockages. Nutritional guidelines. Eat fiber-rich foods such as vegetables, fruits, and whole grains. Limit processed foods, sugary snacks, and high-fat meals. Include omega-3 rich fish, like salmon and mackerel, to boost heart health. Stay hydrated and limit alcohol intake. By adopting these lifestyle changes, you can significantly reduce your risk of TIA and major strokes, improving both brain health and overall well-being. Remember the FAST method to detect stroke early in the elderly. Recognizing the early signs of a mini-stroke, TIA, can help prevent the risk of a major stroke in the future. One of the most effective methods for early stroke detection is the FAST rule, a simple yet crucial guide for identifying initial symptoms. F. Face. Observe if one side of the face droops when the person smiles. If one side of the face is unable to move or appears uneven, this may be a sign of a stroke. Arms. Ask the person to raise both arms. If one arm is weaker, cannot be lifted, or falls down, this may indicate a problem with brain motor control. Speech. Check their ability to speak by asking them to repeat a simple sentence. If they slur words, speak unclearly, or struggle to express themselves, this could be a warning sign of a stroke. Time. If any of these signs are present, act immediately. Call emergency services, 911 or your local emergency number, or take the person to the nearest hospital. Time is critical in limiting brain damage and reducing the risk of severe complications. A mini stroke, TIA, can occur suddenly and may not cause immediate long-term damage, but it serves as an early warning sign of a major stroke. Many patients who experience a TIA are at high risk of a severe stroke within days or weeks. If you or a loved one experience any of these symptoms, do not ignore them. Seek immediate medical attention. Early detection and prompt intervention can save lives and prevent lasting brain damage.